Hello, friends. Today we're going to discuss about digital mental health. I am Dr. Suresh Padadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about digital mental health. What is the definition? What are the principles behind digital mental health? Categories of digital mental health, digital phenotypes, and novel initiatives. Let's understand what is digital mental health. Digital mental health refers to the use of information and communications technologies in medicine and mental health, and also other allied health professions to manage illness, mental distress, health risks, and also to promote wellness. Digital mental health has a broad scope and includes the use of wearable devices, mobile health, big data, genomics, e-health, health information technology, and telemedicine. Some of the times, you'll be also having wearable devices such as watches. This device technology can be associated with a sensor, electrodes, like in watches, or else without any specific device along with the application. That is, independent application in a mobile phone. With regard to digital mental health and also digital health, World Health Organization, USAID, and World Bank came with a joint document published in 2015 with regard to digital health. They advocated the use of digital revolution to scale up the health intervention and engage civil society for providing public health. So, this was a landmark decision taken by the world leaders in the area of health. Not only that, World Health Organization Assembly Resolution, that is 12.4, on 71st World Health Assembly Resolution on Digital Health, unanimously approved by the member states in 26th May 2018, demonstrated a collective recognition of the value of digital technologies to contribute to the advancing universal health coverage and other health aims of the Sustainable Developmental Goals. Even WHO gave an important thrust in 2018 discussing about health and digital health technology. Let's understand about this. And with regard to this, World Health Organization came up with three important publications which was published in 2019. They are available on WHO website, and these are the important publications and their title. Let's understand about these three important publications. These were published in 2019. It talks about five important domains. They are first and the foremost is which talks about health system challenges limiting the universal health coverage for the target population. You can see the target population, and also you can, on the other hand, you can also see health system goals and also target population. If you look at the five important domains, first and the foremost is the accountability. That means the people who have been responsible for providing the healthcare need to be accountable. Not only that, supply. Supply with regard to commodities, devices, medications, and also the human resources and also accessibility for health facility. This is the second important domain. Third one is demand, that is continuous coverage and also contact coverage. Quality and finally affordability is an important issue. These are the five important domains which have been discussed with regard to digital health by the World Health Organization. If you look at the coverage of digital health, you can look at this diagram and I'll be able to explain them. If you look at this diagram, you can see the first and the foremost is registration. Registration starts by birth and ends at the death. That means womb to tomb can be considered. That means registration of death and also the birth. Next, once the registration of birth has occurred, you will be also registered for the health facilities. That means you need to have access for the health facilities within the state or into the country. Further, health workers accessible where these health is available, where the health workers are available, the information with regard to health. The next important is commodities with regard to health. It may be medicine, it may be devices, it may be infrastructure. Later, the healthcare workers' knowledge about which services to be provided, regular training of the healthcare workers, updating their knowledge, and also updating about the administrative issues. The next will be healthcare support decision. That means clinical support decision software can be done, which helps the healthcare workers to take decision based upon the software, where the software would have written or based upon the clinical algorithms, which will help the healthcare providers to take decision without any hesitation. And finally, the healthcare workers can follow up, monitor, and also prevent early relapses and also complications. Here, as you can see, the developed countries and also developing countries have a unique challenges, especially with regard to chronic illnesses, non communicable disorders such as mental illness, hypertension, diabetes, substance use. These need to be monitored regularly for long duration of time. The software will help to monitor and also to keep an idea what's happening, and also the course and outcome of the illness and prevention of relapse can be formed. Now let's understand, what does the digital mental health need to be considered and what does it envisions? It envisions across the world access to mental health care. The access to mental health care, even in a developed country, is very poor. And in India, the access to mental health care is very bad. So if you look at the treatment gap is somewhere around 70 to 80%. The next important is ensuring privacy and security and also the confidentiality. The next third one is information with regard to availability of health services with regard to mental illness. And here, digital mental health envisions to decrease the cost of health, redistribution of the available resources. As you know, the healthcare providers are concentrated in urban area. The digital world can redistribute through telemedicine so that the person who's sitting in the urban can provide services to a patient who is in the rural area. Further, personalized healthcare can be planned, and it is nowadays it is becoming a reality. Further, follow up and monitoring of chronic illnesses is an important domain across the health. Transparency and accountability comes with this digital world. And finally, the training and mentoring of healthcare providers, not only in the urban area, and it becomes very important in rural area where healthcare workers working in the remote area can be handled and monitored with regard to early detection and referral. Now let's understand how this acceptance of digital mental health across the world. The acceptance, that is adaptation of this digital mental health based upon outcome of the illness, whether by adapting this technology can we improve the outcome of the illness, the quality of care is improved or not, whether it is cost effective, whether it induces timely intervention rather than waiting for months for a specialist to be seen. And very important is scalability, whether we can amplify the healthcare services and reaching the remote areas where it is not accessible. And finally, it should be simple and easy to use technology for both from the healthcare provider side and also user side. These are the important domains which need to be taken care when you want this acceptance or adaptation, or considering the digital mental health ubiquitously can be increased and accepted across the population. Now let's understand the exponential growth of digital mental health. Is it a reality or is it happening? Of course, it is happening. The digital mental health is increasing phenomenally thanks to COVID. The COVID made this reality. There was lot of hesitance by the healthcare provider with regard to digital health, specifically to telemedicine and telepsychiatry. COVID increased the acceptance. The next important was availability of smartphones. The smartphones penetration increased phenomenally in Southeast Asia, and hence the acceptance of digital health is also becoming a reality. Along with that, internet penetration, that means digital divide between the haves and have nots, is decreasing so slowly, especially in India. Many people are having access to digital, that is internet world. Further, the youngsters are writing codes, and also proliferation of various health apps are occurring. And finally, the acceptability of users are increasing, especially again it is because of COVID. And if you look at the one of the important publications which was published by British Medical Journal Open Access, the title of the study is Digital Health Intervention for Management of Mental Health in People with Chronic Disease. A rapid review was done. This was an important article which was published in 2021. And if you look at this study done the review of 35 reviews totaling 702 primary studies. That means it is a review of the review studies. And what does it say? The review concluded that the digital health intervention occurring in the area of chronic health condition, including mental illness, appears to be safe and effective, but healthcare provider directed use of application needs to be taken in caution with regard to security and confidentiality. That means we need to keep the data secured, and also it should not be available to any person. Further, let's understand the principle behind the digital mental health. There are important principles which need to be kept in mind, such as understanding the existing ecosystem should be the first step. You need to understand so that you can build a digital world across the available ecosystem and what are the challenges. When you are doing this, you need to work with the users. The users are both the healthcare provider and the patient. Hence, you need to work with them so that the digital world which we are going to envision and make it a reality, so that both the parties can use it. You need to design this app for scaling up in such a way it can reach to the last person in the last village in a last mile. And you need to build for sustainability, and it should be based upon the data driven rather than emotionally driven. You need to use open standards so that anybody can adapt and it can become a reality even in a developing country and also for a poor people. And you need to address the privacy and security issues, which is a burning issue, especially in a developed country. Slowly, it is also becoming a big issue in developing countries like India. You need to reuse and improvise on the applications, and you need to be collaborative when you are implementing digital mental health. One need to understand the health technology is growing at a rapid pace. And if you're planning to implement certain applications, by the time you implement, the technology would have grown miles ahead. So you need to be aware of this, and you need to collaborate both with the healthcare provider and also the technology driven person who is writing the codes, so that you can collaborate and update regularly. If you look at this figure, you can see the number of health applications available in Google Play Store from 2015 to 2022. You can see quarterly the number of applications which are released and available on Google Play stores are phenomenal. At this point of time, roughly around 4.5 lakh applications are available with regard to health. It may be wellness related application such as fitness, diet related. Some of the applications may be with related to distress related, and some applications with regard to disorders and illness related applications. This proliferation of health application is an important phenomena which is occurring in the health sector. Although the information and technology is there since 1990, but the rapid adoption of this digital health is occurring recently, that may be around 3 to 4 years after the COVID. Now, as I mentioned, there are around 4.5 to 5 lakhs of applications available. And as you know, it's a huge market. It is a multi billion market. In 2023, the estimated market is $49 billion, and it will be increased to $105 billion by 2030. That means huge companies are investing, looking at the lucrative market and also an opportunity. And every year, the compounded annual growth rate is somewhere around 11.6% by the some of the estimates, and some of them have said even it is thus 13% annual growth rate compounded, which has been mentioned. And these applications are becoming very useful and also promising with regard to managing chronic illnesses. This is main reason being we are seeing geriatric population is increasing in many developed world, and also the youngsters population is increasing in developing country. So so what? The geriatric population have to travel to the hospital. Here, the digital world will help them to consult the doctor by sitting at home. Now, what about the youngsters? The new millennium generation or Gen X is the population would like to use digital technology. So, the extremes of the population are adopting the digital health technology, my dear friends. So, there is a rapid proliferation of this application, and there is a huge market which is going to be there in maybe in another 5 to 10 years. So, if you want to focus on your growth, focus on health application, digital applications with regard to health. Now, let's understand what are the different categories of digital mental health. If you look at the categories, first and the foremost is remote sensing, monitoring, and wearable devices. By wearing the watches or a sensors which can monitor the activities of the person. Second one is telemedicine and health information. Third one is data analytics, intelligence, and predictive modeling of an illness or public health related. Health and wellness behavior modification apps, applied gaming. That means many number of games are being used for therapeutic and rehabilitation purpose. The next important is mental health social media, where social media is playing an important role in providing education, decreasing stigma and discrimination. But however, one need to understand social media is a boon at the same time also a curse. The people who are learned, who are educated, need to be in social media to break the myths. Otherwise, the noise will increase in the social media. This next important is digitized mental health record platform, that is EHR, is an important boon. At the same time, we need to secure the data. The next one is patient physician portals so that they can interact seamlessly and the care can occur without any break. The next important is diagnosis, compliance, and treatment related applications. The next is decision support systems, especially for healthcare providers, are available nowadays. These are based upon the clinical guidelines algorithms, and these algorithms will help the clinician to be updated and follow those algorithms based on the software, and they can be providing up to date care. Finally, the comprehensive model is the combination of all these so that a comprehensive, holistic healthcare can be given to the person who is in need. Now, let's understand the types of digital mental health based upon the phases of care. That means at what time you are providing the care at the time of illness based upon various applications are done. For example, if a person is healthy, wellness applications will be helpful with regard to doing yoga, maybe exercise, regular fitness app, gym applications are very, very essential to maintain wellness. Some of the apps are helpful, especially when they are stressed or distressed. That means during this period, these applications may be applications with regard to relaxing, maybe music, and also breathing exercise, also been found helpful in certain studies. Certain applications are with regard to diagnosis, some of them with regard to documentation, such as EHR and EMR, monitoring apps, especially with regard to chronic illness, treatment applications, rehabilitation applications, and again, the combination of above applications can be considered for digital mental health, my dear friends. Now let's understand. You have the apps. These applications, what they are going to do, they are a very specific phenotypes will be monitored. They are called as digital phenotypes. Let's understand what is digital phenotype. According to John Torres, he mentioned digital phenotypes for the first time in 2016. As per the Torres, digital phenotype means moment by moment quantification of the individual level human phenotypes in situ using data from personal digital devices. Let me explain this. Suppose if you are wearing a smart watch, it is monitoring your pulse rate, that is heartbeat. At the same time, it is also monitoring your ECG. That means you are continuously, you can monitor your heart rate and also electrocardiogram. This is a digital phenotype, digital phenotype of monitoring heart rate and also ECG. Here again, these digital phenotypes can be divided into two types. One is active phenotype, another one is passive phenotype. What is this active? Here, the user, that is the patient or the client, will be giving or putting or maybe giving data actively. Whereas passive means the person will not do anything. It is the device which will passively will record the data. Here, the based upon the inputs given by the user. If he is giving actively by doing something or entering the data, it is called as active. If it is passive, he is not doing anything. Only the device is recording. Now let's look into various types of digital phenotypes. Let's look into the passive. Passive means if you are wearing this sensor will record them. For example, language and speech analysis, that is voice analysis. Voice analysis have been found to be very useful in diagnosing even Parkinsonism. At the same time, it is also found to be very helpful in diagnosing depression. Further, content consumption. That means if a person is consuming certain media, especially if a person is depressed and suicidal, he will be visiting certain consumption, especially with regard to how he will commit suicide, what has to be done, where to go. That kind of consumption can also be used as a digital phenotype. Facial expression. As you know, in depression, the facial expression of certain things will clearly indicates of depression. Geographical movements. If a person is at home for longer duration, maybe 5 to 6 days or 1 to 2 weeks not moving out of the house, can easily be considered as a mental health issue. Or else a person is actively roaming around continuously, even in the daytime and night time. That means again we are discussing about certain mental health issue. The movements which are not regular but erratic changes can be considered as a digital phenotype. Social interactions, especially on social media. Physical activity. How is the sleep? Nowadays, sleep sensors are available. That sleep pattern will clearly indicate early relapses or the person has a relapse. Heart rate, heart rate variability, physiological data, those can be done by using sensors. Finally, the sweat analysis and EEG and ECG can be monitored by various sensors. These are all passive data. Here, the devices will record and send it to the server. Now let's look into the digital phenotyping, especially active. Here, the user or the client will be doing actively some inputs will be given, such as mood charting. How is his mood in the morning, afternoon, and the evening? He will be entering certain data. That data will be taken to the server, and over a period of time, you'll be able to know how the mood is over a period of time, maybe 1 month, 2 month. Thought diary, medication intake, anger charting, substance intake related, suicidal thoughts, and cognitive tasks. These are the various inputs can be given by the client and it will be considered as active digital phenotyping. Now let's look into the certain important other phenotyping where the research is growing very fast, but unfortunately, many of the countries do not share, such as forensic psychiatry digital phenotyping, facial expression to know whether the person is telling lie, comparing hemifacial expression, half side, that is the right half of the face versus left half of the face, how the expression, whether they vary, and if they are varying, under what circumstances, is it under stress, if the person is telling lie. Based upon the algorithms, we will be able to tell eye movements, vocal analysis, voice analysis, heart rate variability, respiration rate, pupil, brain fingerprinting, body language, sweating, and also various other forensic psychiatry digital phenotyping is available, and they are being they are available, but unfortunately not in the public domain. And what is the use of this digital phenotyping? Although you are getting a massive data of digital phenotyping by the wearable sensors, unless unless which is coupled with the electronic health records and a good history, if you are able to amalgamate all the three things, then the data will be very rich, and you'll be able to make very important prediction with regard to public health policy. Let me explain this very clearly. If you have only health records, these health records are snapshots of the illnesses or wellnesses. You do not have longitudinal data. That is with regard to health record. Now let's understand about the digital phenotypes. These Apple iPhone, Apple Watch, or maybe Samsung Watch, or many other digital technology watches or wearable sensors are collecting data 24 bar 7. They are available with their companies. What is the use of that? These data may not mean anything, although it is available for 24 bar 7 and also 365 days, unless it is coupled with the health records. What is the illness? What is he suffering? What medication he is taking? You need to couple with that. Along with that, you need to know the life charting of the events with regard to that person. If you are able to couple all those things, that is the cross sectional snapshots of health record, longitudinal digital phenotyping, and the clinical history which is available by the clinician, all three will give you an important health record which you cannot imagine, and you'll be able to understand the complete lifestyle of a person from womb to tomb, my dear friends. Now, let's discuss about novel initiatives in India. What are the things which are happened during COVID and after COVID? First and the foremost is eManas. This is a digital platform for implementation of Mental Health Care Act of 2017. I've made a separate video with regard to eManas, which is available in my YouTube channel. Similarly, there is a Telemanas, which was implemented by the government of India. A separate video I have been done, and it is available in my YouTube channel. The next one is Karnataka Telemedicine Mentoring and Monitoring Program, that is KTM, Niman's Eco Model, Clinical Decision Support System, which was done by PJ Chandigarh and TCS, Amma Manasu, that is Mother's Mind, a novel initiative which is done by Digital Health, and also Atmiyatha, that is Mitra and Champions, which is done by ILS Pune, Ummeed, that is Hope, a helpline with regard to digital health initiatives, Monon of Assam, a COVID program which was done to provide psychosocial support for the COVID survivors and their family members. Similarly, Manswad of Rajasthan, BMC Empower one-on-one helpline with regard to Maharashtra, Manas, mental health and normalcy augmentation system, Man Mela, art-based breaking stigma and discrimination, systematic medical appraisal, referral and treatment smart card CMD, Pod Adventure, that is lay counselors guided problem solving intervention, that is problem identification, option generation, and creating plan. Further, other important digital mental health initiatives are Inner Hour, Trijog, eCyclinic, Your Dost. Visa is a AI-based chatbot which was been awarded as one of the best award in 2015. Talk to Angel, and finally, the National Medical College Network. This is the initiative from the Ministry of Health and Family Welfare, where there is a vision to connect all the medical colleges under a single network called as National Medical College Network. This will help in providing information and also developing a repository of learning with regard to medical education, so that the students from various medical college, maybe from the private, maybe from the government, will get the best of the best teacher available on the network, and he will be teaching the students across the country. Think about it. And this will make the requirement of medical college with regard to teachers maybe decreased over a period of time, and quality education, standardized education will be there across India. To conclude, my dear friends, digital mental health is a multi-billion dollar industry, and it is expected to grow exponentially every year, whether we like it or not. The industry and also the public at large is looking for digital technology to provide services with regard to treatment gap. Hence, the digital mental health, which refers to the use of information and technology in providing wellness, prevention, promotion, diagnosing, treatment, and rehabilitation of persons with mental illness, is going to be a game changer in the field of mental health, my dear friends. In my next video, please expect about the effectiveness of digital mental health intervention. What are the research findings at this point of time? What are the challenges and opportunities? And future of digital mental health will be discussed in part 2 of this video. Thank you very much for giving your valuable time. Stay safe.